Does the COVID vaccine reduce the rate of death for children under 18?
It can.
Once again, it can. That's a ridiculous answer. No, it doesn't, and there is no statistical evidence that it does reduce the death rate. These are statistics. We've looked at it. So you resisted firing people who have this idea that the COVID vaccine should be at 6 months. That's what this is about. You didn't resist firing the perfect, beautiful scientists that are career people and unobjective and unbiased. You wouldn't fire the people who are saying that we have to vaccinate our kids at 6 months of age. What is the medical, scientific reason and proof for giving a newborn a hepatitis B vaccine if the mom is Hep B negative?
I want to go back to the assertion associated.
What is the medical reason for giving a hepatitis B vaccine to a newborn? See, everybody's like blithely going along, we can't change the childhood. You're somehow terrible if you want to change the childhood. We should be discussing what is the childhood vaccine schedule. Menares, I agree with you completely that we need to restore trust in public health. But in order to do so, we have to have a discussion about the actual science, and we can't have a discussion this, is about all vaccines are good, all vaccines are bad. This is about specific vaccines, it's about specific age groups, and it's about specific policies. Does the COVID vaccine prevent transmission?
The COVID vaccine can reduce viral load in individuals who are
Does it prevent transmission?
When you have reduced viral load, you will have reduced transmission.
But in other words, it doesn't prevent transmission. You can still transmit the virus if you've had the vaccine. In fact, there's been reduced ability to interfere with transmission over time. And what we've found is the most recent one since Omicron is down around 16% reduction, if there is a reduction. Does the COVID vaccine reduce hospitalization for children under 18?
It can.
It doesn't. The statistics are inconclusive, and the reason you can't prove that it does is there's so few people under 18 that go to the hospital. The numbers are extraordinarily small. There's like 76 million kids under 18 in our country. 183 died, and a few thousand went to the hospital in 2020 and 2021. And since then, the numbers have dropped precipitously, and the idea and the issue needs to be discussed. But the COVID vaccine is not reducing hospitalization. It's not statistically significant. Does the COVID vaccine reduce the rate of death for children under 18?
It can.
Once again, it can. That's a ridiculous answer. No, it doesn't, and there is no statistical evidence that it does reduce the death rate. These are statistics. We've looked at it. When they approved it, they had this discussion at the vaccine committee that we've been talking about. During the discussion, they acknowledged that there was no proof of reduction in hospitalization or in death. So what they did is they said, what can we use to try to make people take this vaccine? They came up with this. They said that if we give you a COVID vaccine, you make antibodies. So really the whole recommendation for having a COVID vaccine from 6 months up is not based on hospitalization data, not based on deaths. It's based on whether you make antibodies or not. And what people fail to see from this is I can inject you with a foreign protein every week and measure your antibodies. You'll make antibodies every time. It just means immunology work has nothing to do with whether you should get a vaccine every week. So when we're discussing the science here, we have to discuss what is the science in favor of giving a vaccine to a 6-month-old and what are the benefits from that. And there is no benefit of hospitalization or death. And then what would the risks of the vaccine be? We have large population studies of the risks of the vaccine in younger people. And it turns out that you don't see this as much if you look at the general population, but once you start isolating in by age group, which you have to do in COVID because there's such a disparity among age group, you find that there is a risk of myocarditis, a significant event. It's somewhere between 6 and 8 in 10,000. But that's much greater than the risk of hospitalization or death, which are not even measurable because they're so small. So you resisted firing people who have this idea that the COVID vaccine should be at 6 months. That's what this is about. You didn't resist firing the perfect, beautiful scientists that are career people and unobjective and unbiased. You wouldn't fire the people who are saying that we have to vaccinate our kids at 6 months of age. That's who you refuse to fire.
So that assertion is not commensurate with the experience that I had with the individuals who are identified to be fired.
Did any of the people you refused to fire, did any of the people you
Allowed to
refused?
answer the question?
Did any of the people you refused to fire believe that we should change the vaccine schedule and no longer force 6-month-old kids to take it? Every one of them was adamant we should keep it at 6 months. Everybody's alarmed, we're going to change the childhood routine. Well, we should. There is no medical reason. What is the medical reason to give a hepatitis B vaccine to a newborn whose mom has no hepatitis?
So none of the discussion points that you just brought up were ever,
That's changing the childhood schedule.
Will you allow her to answer the question?
Regular order,
Have
regular
your
order.
time. You have your
Regular
time,
order.
Bernie. I got mine. Look, this is the debate over changing the childhood schedule. The hepatitis B vaccine on the schedule is given to newborns. What is the medical, scientific reason and proof for giving a newborn a hepatitis B vaccine if the mom is Hep B negative?
I want to go back to the assertion associated.
What is the medical reason for giving a hepatitis B vaccine to a newborn? See, everybody's like blithely going along, we can't change the childhood. You're somehow terrible if you want to change the childhood. We should be discussing what is the childhood vaccine schedule, and the burden should be on you. You want to make all the kids take this? The burden is upon you and the people you wouldn't fire to prove to us that we need to give our 6-month-old a COVID vaccine and that we need to give our 1-day-old a hepatitis B vaccine. That's what the debate ought to be about, not whether all vaccines are good or whether we live in Alice in Wonderland.
I actually agree with you, and I was open to the science. I just would not pre-commit to approving all the ACIP recommendations without the science.
Untrue.
Is the witness allowed to answer that question, or do I have to use my time?
Did she answer the question? Did you have more to say, Dr. Monarez?
The last thing I wanted to say about those scientists, we had never discussed any of their thoughts, considerations. Or
We being we, who is we?
me and the scientists that I was being asked to dismiss. As far as I know, they had never said that they are pre-committed to maintaining any of the decisions that had been made. All of us had agreed that the science evolves and we need to see the data and the evidence to ensure that we are protecting our children.
Okay. Senator Murray.
Thank you, Mr. Chairman. In May, Secretary Kennedy announced in a video on social media that the COVID vaccine was no longer going to be recommended under CDC guidelines for most children and pregnant women. The fallout was actually immediate. I heard from a nurse in my state who was pregnant. She was trying to get the vaccine. She was turned away by several pharmacies, ended up calling my office and saying, what am I going to do? Dr. Howery, I wanted to ask you, how did you learn about CDC's new COVID vaccination guidance in May?
The same as you on social media.
What was your title at CDC when that happened?
I was the chief medical officer of the agency.
It's unthinkable to me that the chief medical officer at CDC was left in the dark about such a consequential public health decision that affected real people. Dr. Howery, how was this change in guidance supported by scientific evidence?
We have not seen the data yet. In fact, after the tweet came out, we asked for a written memo from HHS because I couldn't implement guidance off of a tweet. The written memo didn't say the same as the video. There was a difference between healthy versus all.
You can't provide guidance off of a tweet.
I didn't think that was prudent. And then we did ask for the data to back it up, and we have not received the data to date.
To date, no evidence, okay. Well, the Secretary has made very clear that he wants to change the childhood vaccine schedule for measles and chickenpox and Hep B, as well as the COVID vaccine recommendations. And as we all know, the ACIP is meeting tomorrow to consider those recommendations. Dr. Monarez and Dr. Howery, I want to ask you both, are you aware of any scientific evidence to support changing the age of which children should get these vaccines that's being considered by this advisory committee? Dr. Monarez.
Sorry, I apologize. I am not. I was certainly open if there were scientific data sets or evidence associated with anything that would help keep our children safe. I was open to seeing it. I have not seen that data.
Dr. Hari?
Ditto. We've asked for the data and asked for the modeling to support any decision that is done.
Are either of you aware of any scientific evidence to support changing eligibility for COVID vaccinations?
I have not seen any evidence.
No.
I think it's pretty alarming that if there was such data, the CDC director and the medical officer would absolutely be aware of it.